When ultrasonologists reported bright livers or fatty livers 3 decades ago, we dismissed it as being something inconsequential. However, if you look at how medical science has evolved over these last 3 decades and how data has clearly showed us that fatty livers are not innocuous entities, but they can have fairly serious repercussions. However, even today, we find a lot of physicians not very serious about recognizing or even considering these patients for any management specific for fatty liver disease. In my own practice, we target out patients who not only just have liver abnormalities or biochemistry, but even simple clinical examination where we find a palpable liver, often a little firm in consistency, with or without biochemical abnormalities, and evaluate them further. And the group that we feel which has perhaps the highest chance of progressing to serious kind of liver disease like NASH or progressing to cirrhosis are those with diabetes, those with a metabolic syndrome, those who often have dyslipidemia, obesity, and a family history of chronic liver disease. These are patients that we subselect for more aggressive therapy. And we find that fatty liver due to non-alcoholic fatty liver disease is now quickly overcoming both hepatitis B, C, and coming close to alcohol as a major cause of liver disease in India. The most interesting part about all this is that all these diseases are preventable. So 95% of all liver disease in India, if you look at hepatitis B, C, alcohol, and NASH, are all preventive diseases. You can prevent liver cell failure, you can prevent cirrhosis by a quick recognition and therapy. So a serious message that needs to go down to all physicians is recognize fatty liver disease, recognize it that it's an important entity which, if left untreated, can have serious consequences as far as the patient is concerned. So fatty liver disease is here to stay with our lifestyle changes, but we need to take steps to prevent, and if it has developed, to treat it adequately.